Dr. Carrie Best, peer assessor at the College of Physicians and Surgeons of Ontario. Ontario MD is collaborating with the college to provide CPSO assessors with training videos on how to review various electronic medical records. This video will demonstrate how an assessor can review relevant practice information using OSCAR. In viewing this video, the assessor will become familiar with the key components of the record that they are assessing. This is a demonstration of OSCAR EMR software created for the purpose of producing an instructional video for CPSO assessors. This demo is being recorded on a Mac. A Windows-based PC screen might look slightly different. There is an assumption that the assessor will be assessing a computer with OSCAR open on the desktop, set to the login screen as shown here. In this demonstration, the login area is blank. The assessor will enter their own username and password provided by the clinic that they are assessing. I will use the password provided to me by the clinic in the space below. When the password is entered and the Sign In button activated, the assessor is brought to the home screen, which is the scheduler. Patient names can be searched in two ways. First, if the physician provides a list of charts to be evaluated, one can use the menu at the top of the screen, click on the search icon, and enter the patient's last name followed by first name to find and open the chart. In this demonstration, we will use test, Chris to open a demo chart for a patient named Chris Test. This will open to the demographics section of the chart. Choose the E icon under Module to open the electronic record. Close the chart by clicking the X in the tab area at the top of the screen. Alternatively, if the physician has entered the patient charts onto a day sheet, then one can use the menu at the top of the screen, click on the calendar icon, and select the date for which the day sheet has been prepared. In this case, we select January 10th, and it opens up the schedule for that particular date. For each patient, the electronic record can be accessed by choosing the E icon. Again, to close the chart, click on the X in the tab at the top of the chart to return to the day sheet on the schedule. Choose the M icon to open the patient's master record. Immediately, the demographics are visible. From here, one can choose appointments along the left-hand side of the screen to access the patient's appointment history to see past or upcoming appointments. To close this section, click the X in the tab at the top of the screen to return to the master record. The assessor will not need to concern themselves with the other components of the chart listed on the left-hand side of the screen. From here, one can choose eChart to return to the electronic medical record. Returning to the test chart, choose the E icon to open up our demo electronic record. From here, one can click on the patient's name at the top left of the screen to open up the master record once again to see the demographics and a list of any referring physicians. From the electronic record, one can also choose the next appointment icon on the bar at the top of the chart beside the patient's name to access the appointment history. Close the tab to return to the electronic record. The CPP is located at the top and the right side of the screen. One can highlight information contained within the CPP to see when that information was entered or edited. The encounters are located under the CPP in chronological order, with the most recent note at the bottom. Previous encounters can be visualized by scrolling up through the record. For each encounter, one can see the date of the visit and the provider's name. To see the full note, click on the arrow icon at the right-hand side of each note. The left-hand side of the chart is the clinical tools zone of the electronic record. Preventions is where one can track preventive care, such as Pap tests and other cancer screening tests like FOBT or mammograms and immunizations. Ticklers, which are tasks or messages between providers or administrative staff, can also be found in this section. For example, a tickler may be a note to a staff member to send a referral to a specialist, or it can be set up as a reminder to track a particular test result. Choosing the tickler section brings us to active or outstanding tasks. In this case, there are none. To evaluate completed tasks, go to the Move To section at the top of the screen and choose Completed. Then choose the Create Report icon at the right side of the screen to generate a list of completed tasks for this particular patient. In this case, one can see that a tickler was set to track a PAP report, including the date it was set as well as the date it was completed. Exit the tickler section to return to the electronic chart. Under the tickler section, again on the left-hand side of the chart, is the Forms section. This is where the antenatal record can be found. Choose Antenatal Record to open the Antenatal 1 form. One can scroll down to evaluate the entire form. Using the Edit area at the top of the screen, click on AR2 to open the Antenatal 2 form. Click the X at the top of the screen to exit out of this form and return to the electronic record. The Forms section is customizable by each clinic. In this case, a pre-populated lab requisition has been designed to use for antenatal patients. The Documents section contains components of the medical record that have been scanned in, such as imaging reports and consult notes. These are listed in chronological order. To see past results, click on the arrow at the side of the section to expand this area. To visualize a particular result, highlight and click to open it. Initially, one will just see the first page. To access the entire document, click on the image itself and scroll down. Once finished evaluating the document section, hide the expanded area by clicking on the side arrow again. Above Documents is the eForms section. From here, a consultant can create a letter to the referring physician, or a physician can provide a doctor's note for a patient. This is also a customizable area where clinics can add driver's physical templates, WSIB forms, accessible parking permit forms, eye exam forms, smoking cessation flow sheets, mood questionnaires like PHQ-9, the Rourke record, periodic health exam templates, and prenatal and other lab or hospital-specific requisitions. This section can also be expanded by clicking the side arrow to see older forms. Beneath Documents is Lab Results. Lab results will automatically populate this area. In this demo chart, there are currently no results listed. If there were, one could just click on them to open them up for viewing. Messenger is a mode of communication between provider and staff for various reasons, such as booking procedures or appointments or finding particular results. Beneath Messenger is Measurements, which includes chronic disease management flow sheets, such as diabetes, and vitals, such as BMI or blood pressure. From here, one can graph certain measured values. The Consultation section contains information regarding referrals sent to other physicians displayed by specialty. One can click on an individual referral to obtain more information. Back to the CPP. On the right side of the chart, one can find more information about allergies and medications. To see which medications have been prescribed, click on Medications to open a new window containing a list of current and previous prescriptions listed in chronological order. Other medications are those that the patient is taking that are not prescribed by the provider. The Episodes section in this chart is used to store previous antenatal records from past pregnancies. Once finished reviewing the chart, click the X in the tab at the top of the screen to return to the patient search area. One can then enter the next patient name, click Search, and choose their name from the list. To open the next chart, click on E beside their name and review as previously described. This concludes our video presentation for CPSO assessors using OSCAR to assess the electronic medical record. On behalf of Ontario MD and the College of Physicians and Surgeons of Ontario, we'd like to thank the CPSO assessors who provided us with guidance and feedback along the way. We'd also like to thank CHI Innovations for allowing us to use their OSCAR software. Thanks for watching.